just gonna get started into this, so I'll just have to lay down.
Okay.
So we'll do the uninvolved side first, so that being her left side. So first, I'm gonna have you can relax both legs and straighten them out. Perfect. We're gonna go through hip flexion first, which would be your axis would be your greater trochanter. Your moment arm would be in line with your mid-axillary line, and then your lateral epicondyle would be your moment arm or stationary. So palpate for the right there. Okay, perfect. I'm gonna have you flex all the way up. You can straighten this leg. Perfect. Keep going, keep going, keep going. Perfect. Hold it right there. Lateral epicondyle, mid-axillary line, greater trochanter. Perfect. And that one is 120 degrees, which is just below, which is just at the normal range of motion. We'll also do passive range of motion, so just relax entirely. You bend your leg a little bit to 90 degrees, perfect. Go all the way that you can. Perfect. Right there. Greater trochanter. Perfect. And that one is 135. So even more. So now we would do the other side, which is the same markings. Your greater trochanter being your axis, your movement or your stationary arm being your mid-axillary line of your thorax, and then the in line with the lateral epicondyle would be the moment arm. Perfect. Feel for the greater trochanter. Perfect. Right there. Any more, right there. Perfect. (115 degrees, so a little under normal value considering it's 120. So we'll do the same thing for passive range of motion. I'll have you lay down. Perfect. I'm going to grab right here, bend the knee. Feel the greater trochanter. Push, keep going, keep going. Oh, there you go. Mid-axillary line, lateral epicondyle, greater trochanter. And that one is 125. So a little less. Your agonist being your psoas major and your iliacus, and then your rectus femoris, while your antagonist would be your glute max. So next we'll do hip internal rotation. So I'll have you lay on your stomach. Again, we'll do the left side before her right side because her left side is the uninvolved side. So I'm gonna have you bend your knee at 90 degrees. Perfect. Your anterior patella being your axis of rotation, perpendicular to the floor being your stationary arm, your movement arm being in line with your tibia. So I'm gonna feel for the greater trochanter. Right there. Don't move, don't move. Perfect. And that is 52 degrees. So that is above average, considering the normal range of value is 45. So we're going to do the same thing, but for passive. So greater trochanter, perfect. Right there. That one is 52 or 53, sorry, degrees. So pretty much the same. You can relax this foot. Now we do her right side, being her involved side. So I'm gonna have you bend your knee at 90 degrees. Perfect. Palpate the greater trochanter. Right here. Perfect. Any more? Perfect. Have you stay right there. That one is 53 degrees, so pretty consistent. Now we're going to do passive range of motion again. Relax, relax, perfect. Keep bringing it down. Right there. 57 degrees. So again, both are above average because normal range of value is 45. Your agonists for this movement are your glute minimus and medius, and then your antagonists would be your piriformis and then your superior and inferior gemellus. Next, we will do hip abduction MMT. So I'll have you lay on your side and lay facing that way. We'll do the left side first, considering it's her uninvolved side. So we will have her right leg bent 90 degrees, so she can stabilize herself. You're right there. You're right there. So I'm gonna have her straighten her leg out. Go through the range of motion. Feeling it, perfect. So I'm gonna hold down on your pelvis. I'm gonna stabilize the pelvis. I'm gonna push down here. You try to resist that. You ready? 1, 2, 3. No break, so I would give that a 5. Now we'll do the same thing the other side if you wouldn't mind just laying there. Perfect. So same thing, have her left leg bent a little bit so she can stabilize herself. Here, relax a little bit. Got the greater trochanter right here. I'm gonna stabilize your pelvis. Here, hold your leg. Same thing, I'm gonna press down, you try to resist, okay? 1, 2. A little break, I would give that a 4. So now we're gonna do gravity minimize, and I'll have you lay back on your back, please. And I want your left side first. So I'm gonna have you slide all the way to that side of the table. Perfect. So, ASIS pelvis. So now I want you to bring your left side all the way out. Do it one more time, please. Okay, I can feel the contraction, and she moved, so that would be a 2. So same thing, we're gonna go to the other side, perfect. Stabilize right here. So same thing, bring your right side to me. Do it again, please. Good, perfect. I felt the contraction, you were able to do it, so that would be a 2 as well. Next, we will do the Thomas test. So for that one, I'll have you sit right here, please, right at the end. So we're going to test her uninvolved side first. So I'm going to have you grab right here, grab the back of your knee, perfect, and then lay down, lay back on there. I need you to slide up a little bit. Perfect. So relax. Gonna feel for the ASIS. So once it is in posterior pelvic tilt, right there. So now I want you to grab this leg. Thank you. Stabilize it right on the side of my thorax. You can relax this leg. Relax this. Perfect. ASIS. ASIS is in anterior tilt. Her knee is somewhat flexing, so there might be a little tightness in her psoas major and, her rectus femoris and her TFL. Normal values for that would be 0 degree hip extension and 90 degree knee flexion. So now we're going to do the same thing, but on the opposite side, so I can relax. Perfect. Here, come back up here. Slide back. No, like. Okay. You're good. Now drop this knee down. Okay. I'm going to have you hold on to this leg. Perfect. So, again, feel for the ASIS. Posterior tilt now. Have you hold on to here. Hold on to your left leg. Perfect. You can stabilize this right here. Relax your right leg. Perfect. Again, feel for the ASIS. In this leg, her right leg degrees, so there's definitely no tightness there, which is a good thing. You can lay back up here, lay on your back, please. Now we would do knee flexion and extension. First we'll do flexion. So your accesses would be your lateral epicondyle, your moment or your stationary arm would be in line with the greater trochanter, or basically the femur, and then your lateral malleolus would be your your movement arm. So have her bend this knee, go through range of motion. Perfect. You can relax a little bit, just right there. So get the stationary arm. Perfect. And now same thing, we're gonna compress. Perfect. And that one is 145 degrees with the normal range of motion being 130 to 140. So that is definitely good. Now we're gonna do the same thing, except passive range of motion. So I'll have you relax your leg entirely. Perfect. And I'll do this for you, so no worries. I'm gonna bend your knee as much as we can. Keep going, keep going. Perfect. That one's also 145, so same thing. Now we would do her uninvolved or her involved side, so you can relax this leg. Perfect. So for this one, again, access is the lateral epicondyle. Moment arm or stationary arm would be in line with the greater trochanter or the femur, and then your lateral malleolus is your moment arm. So, here I'll begin this. Keep going. We'll compress. Perfect. Okay, relax a little bit. So now I got the axis lined up, the stationary moment arm. So flex your knee, bring it in, compress. Perfect. And that one is 140 degrees, so just right at average. So I'll have you relax your leg. And now we're doing your passive range of motion. So relax your leg. Perfect. Same axes and landmarks as before. In line with the lateral malleolus, the greater trochanter, the lateral epicondyle. Press in. – 142 degrees. So more passive range of motion than active range of motion. Her agonist would be her hamstrings, and your antagonist would be your quads. So now we'll do knee extension, active range of motion, passive. So I'll have you lay on your. Actually, sorry. No, keep it like that. I'm gonna need this though. Sorry. So we'll have her right leg bent at a 90 degree, and then I'm gonna prop her left leg up so then so the table does not block any of her knee extension if she has hyper mobility. So same axis as before. Your lateral epicondyle is your axis. Your greater trochanter in line with your femur is your moment arm, or stationary arm, sorry. And then your moment arm is in line with your lateral malleolus. So that all. Perfect. And that one is at 2 degrees. So you have, and then we'll do passive. We'll see if there's any extra range of motion. That one was also 2 degrees, so no extra range of motion there. So now for her right side, I'll have her flex her knee for a little bit of comfortability and stability. Same axis as before. Lateral epicondyle is your axis. Moment or stationary arm is your greater trochanter with your femur, and then your lateral malleolus is your moment arm. So, same as before, in line with the greater trochanter, lateral malleolus. that is -1 degrees, so have a little bit of hypermobility there. So then we'll do the same thing in line with the accelerating. No hypermobility there, still -1, same thing. So, and her agonist would be your quadricep muscles and your antagonist being your hamstrings. So now we would do knee extension MMTs. First, I'll have you sit right on the edge right here. So, here, can you uncross your legs, please? Perfect. We'll do her left side first because it's our uninvolved side. So first, I'll have you extend your knee all the way out that you can. Perfect. Okay. So now I'm gonna unlock it, unflex it totally. Okay, perfect. Right there. We're gonna have about roughly 20 degrees, so then the locking out mechanism isn't a part of this. Stabilize the hip. I'm gonna press down here. I want you to resist. Okay. So 1, 2, 3. No break. I'd give that a 5. Same thing on the other side. Could you go all the way up, please? Perfect. Have you unflex a little bit, or unextend, sorry, a little bit. Perfect. Stabilize the hip. I'm going to press down. You're going to resist. So 1, 2, 3. No break. I'd give that one also a 5. Finally, or not finally, we'll do gravity minimize. So I'll have you lay on your left side. Perfect. Here, you need this. Perfect. So I'm going to support her top leg, and then you can come your leg down a little bit. Perfect. I'm going to support your top leg, and now I want you to extend your left knee. Perfect. Do it one more time, please. Perfect. So she can do it. I would give that a 2, and then we'll do the other side. I'm going to stabilize her left leg, and then I'll have you extend your right knee. Perfect. One more time, please. Perfect. She can perform those, so I would also give those a 2. Finally, we will do, you can lay on your back now. We will do hamstring MMT. So I'm going to have you straighten this leg out. So we're going to have you flex your hip to 90 degrees right here, and then I want you to extend your leg as far as you can, all the way up. The motion you do. Okay. So same landmarks as before. That one is at 18 degrees. You want below 20 degrees, so that is good. And then we'll do the other side now. So I'll have you perfect. I'm going to flex your knee at 90, keep it there. I want you to extend your leg as far as possible. Perfect. Same landmarks as before. Axis lateral epicondyle, in line with the greater trochanter, and then the lateral malleolus. That one is 18 degrees. So again, below normal value, below 20 is what you want. So that is good. No tightness in your hamstrings, which is good. And that is it. Thank you.